Hello, and welcome back to Florida Surgical Weight Loss Seminars, video number 2. Now, let's get to know the different types of surgeries that are popular for weight loss. Please listen to this segment carefully, as many of your important questions will be answered right here.
But we have 3 surgeries now that are popular. We have the gastric bypass, which is kind of falling out of favor, and not too many people are doing it because it is associated with a few more complications than others, but it is a good procedure, you know, and in the right hands and some very talented surgeons, people do very, very well. But then again, you know, you're cutting pretty much most of your stomach, disconnecting that and rerouting the intestines, and we're going to show you a picture of that, and I'll explain how that works. Then we have the sleeve gastrectomy, and that's removing essentially a good portion of the side of your stomach, about maybe half of your stomach, and you make the stomach into a banana. And the whole point of that is that there's less surface, so you feel fuller faster. It does have some nutritional problems associated with it, and it works quite well as well. But it is removing a good portion of your stomach that's not going to come back. Okay, that's pretty invasive. And boy, you're quick. All right, miss, slow down. And then you get the lap band, and the lap band is again no panacea. I think it works great. The other systems work really great as well. But the lap band is the least invasive, it is removable, and it is adjustable. The others are not adjustable, and the others are not removable. Okay? And you can reverse a bypass, which is really, really difficult, and most people won't do it. All right, this is the connections. This is how it works. Okay? Let's talk about the bypass first. As you can see, most of the stomach is disconnected. You all see that here? Yes? Okay. And then that little pouch of stomach there is connected to the intestines, so that's the bypass part. So the bypass, the gastric bypass, is a restriction, meaning that they make the stomach smaller. That restricts how much food you can take in. And it also bypasses whatever you eat. So you're not using a lot of your intestines. That's why a lot of issues arise as far as nutritional. You really got to keep up with your vitamins and nutrients, because you can have dumping syndrome, you got nutritional problems, ulcers, reflux, all types of stuff. Again, it is a procedure that works, okay? It's been used a lot, but it is very extreme. Sleeve is, like I told you, make the stomach almost a banana. You remove about that much stomach. Now, this stomach stays in, but this stomach is actually removed. Gone. It will not grow back, okay? Thing with the sleeve gastrectomy, too, it works very well. However, and we do them. However, it's permanent. Once it's done, it's done. And if you mess it up, you can convert it to a bypass, or you can put a band over it. I don't know too many people are doing that, but you can do a band over it. Once it's done, it's done. Okay? You can get problems with the sleeve, including a leak. Leaks are very uncommon, but they are about 2%. And a leak meaning that that fluid from the stomach can come out from one of the sutures. You know, because it's a big suture line. You know, I mean, you can put staples all the way down. If one of those areas leaks, it can be quite serious, and you can be in intensive care for a while. Okay? It is not removable. All right? You cannot remove that. You cannot adjust that. Once it's distended and messed up, it's messed up. And then the band. The band is a silicone tube. We put it around the upper part of the stomach, and I'll show you in a minute. We're going to turn on the lights, and I'll show you how it works. And we put it around the stomach. We don't cut anything. Okay? We just separate the tissues, wrap it around, and lock it. And then we put this port right here under the skin. You won't feel it. You won't know it's there. Most people don't even know where the port is. And it's there, and in the office, we numb you up and put a little needle in it and put a little bit of fluid in it and tighten up gradually. So it grows with you. So as you're adapting, it's adapting. And that's a beautiful thing. I like that fact. And we can continue to adjust it years later, okay? Whereas we can't adjust the others. We can also remove the band. God forbid if we have to, but you know, we don't like to, but for whatever reason we have to, you can take it out. And once you take it out, it's out. Okay? Your stomach is back to normal. All right? So let's turn on the lights for a minute. I'm going to show you how the band works and pass it around so you can all see it. So please return them, okay? Otherwise I get in deep trouble with Tina. All right. This is the lab now. This is a plastic model. It doesn't work all that great because it's plastic, but it gives you the idea of how the band works. The band works by having this little pouch up here, and when you eat, the kind of food holds up in here and makes you feel full. So you're filling this stomach and not this one. And then eventually, see, this is why this doesn't work so well with plastic, but in the real world, it works easier than this. And then food passes slowly into the other part of the stomach as it's being digested, and then it continues to be digested the rest of the way. So whatever you do eat, you will absorb. Okay? It's not a bypass. You don't have B12 deficiency or other things, okay? You do, however, have to take a multivitamin once a day. But here's what's important about the band that you need to understand is you have to eat solid food. You have to eat food that stays here for a while. Because if you drink Slurpees, or not Slurpees, but smoothies and soups and stuff like that, it's going to go right through. You're not going to feel full. You're going to be hungry again in less than an hour. You're going to eat again. And calories will add up. So you have to eat solid food, number one. Important. Things that you chew. You eat it with a knife and a fork. Okay? Number two is you have to eat 3 meals a day. You have to keep this pouch full, right? Because if you don't eat all day, and I know a lot of you don't because that's the way it is, right? And you eat at the end of the day, then you're going to be starving all day. You're going to try to overeat at night, and this pouch won't handle it, and you'll throw up and get sick. Okay? And if you do that long enough, you get a slip. You get damage to the pouch, and the band will slip down, and we'll talk about what a slip is later. Okay? So you have to eat 3 meals a day so that you, first of all, you can keep full, and second, you can keep that pouch right, the way it's supposed to be and not overstuff it. And then 3, I do not allow my patients to drink anything with gas, nothing carbonated. That includes sodas, that includes beer, anything that has gas. Because if any of you have ever seen a CAT scan or an x-ray of somebody who's just drank a cola, their stomach gets enormous, just huge. I mean, you know that just when you drink a cola or soda, you can see that the pop is from up north. You'll notice how bloated you feel. Well, imagine bloating that little pouch. Not just on this. Imagine bloating that gastrectomy pouch or that bypass pouch. You're damaging all of those. Okay? Over time, you're going to damage it and cause yourself a problem. So you say goodbye to anything carbonated. You can still have coffee and tea, and you can have all types of flavored waters, low calorie, of course. And you can have all those things. You can even have alcohol with it, you know, in limited quantities because it has a lot of calories, of course. But you can have all those things. You just can't have anything carbonated. Okay? Any questions about this so far? Okay. Now, let me show you how the band works. Guess I gotta go up there every time, right? All right. Literally, the band has a little balloon on the inside here. Okay, it's a clear balloon, and I'll pass it around so you can see it. Okay, and then this is it's all silicone. Okay, solid silicone, so not liquid silicone. Don't worry, it's not going to leak. And then has a little titanium at the connector here, and a little titanium at the base of this here. All right. And it's okay to have titanium in your body. A lot of people have it in joints, and it's okay to have silicone in your body. A lot of people have silicone in their body. Okay, so you can have it. It'll be fine. It's not reactive. Literally, it comes disconnected like that. We connect this afterwards, and we put it into the body, and then we wrap it around the upper part of the stomach, and we do exactly this with instruments, of course, and on an operating table, so it's a lot easier. And then we just snap it closed like that. That's it. Okay? We put a couple of stitches from here to here, not on the band, but from here to here. The stomach is usually in real life very, very floppy. So you guys can go online and see that on YouTube. Okay? Everything's on YouTube. And you can see how we can pick up the stomach because it's very, very floppy and put it up here without any tension. And we put a couple stitches here just to hold it in place so it doesn't slide. Okay? And then your body will heal it in after a couple weeks and it won't matter then. And then this, we connect outside it here, and then we plant that on the muscle lining. Okay, the lining of your muscle that's deep inside underneath your skin. This is not outside. You're not going to be walking around like this or anything like that. Okay, this is underneath. And it attaches to that, and it doesn't move, and you won't know it's there. Okay? Maybe the first couple of days, and after that, you won't even remember it. You won't even know where your report is. You know when we access it in the office. And we numb you up again, okay? I use a Lidocaine to numb you up, put a little needle in. It takes about 5 minutes to fill this up. How do you fill it up? About the band that you need to understand is you have to eat solid food. You have to eat food that stays here for a while. Because if you drink Slurpees, or not Slurpees, but smoothies and soups and stuff like that, it's going to go right through. You're not going to feel full. You're going to be hungry again in less than an hour. You're going to eat again, and calories will add up. So you have to eat solid food, number one. Important. Things that you chew. You eat it with a knife and a fork. Okay? Number two is you have to eat 3 meals a day. You have to keep this pouch full, right? Because if you don't eat all day, and I know a lot of you don't because that's the way it is, right? And you eat at the end of the day, then you're going to be starving all day. You're going to try to overeat at night, and this pouch won't handle it, and you'll throw up and get sick. Okay? And if you do that long enough, you get a slip. You get damage to the pouch, and the band will slip down, and we'll talk about what a slip is later. Okay? So you have to eat 3 meals a day so that you, first of all, you can keep full, and second, you can keep that pouch right, the way it's supposed to be and not overstuff it. And then 3, I do not allow my patients to drink anything with gas, nothing carbonated. That includes sodas, that includes beer, anything that has gas. Because if any of you have ever seen a CAT scan or an x-ray of somebody who's just drank a cola, their stomach gets enormous, I mean, just huge. I mean, you know that just when you drink a cola or soda, you can see that the pop is from you or from up north. You'll notice how bloated you feel. Well, imagine bloating that little pouch. Not just on this. Imagine bloating that gastrectomy pouch or that bypass pouch. You're damaging all of those. Okay? Over time, you're going to damage it and cause yourself a problem. So you say goodbye to anything carbonated. You can still have coffee and tea, and you can have all types of flavored waters, low calorie, of course. And you can have all those things. You can even have alcohol with it, you know, in limited quantities because it has a lot of calories, of course. But you can have all those things. You just can't have anything carbonated. Okay? Any questions about this so far? Okay. Now, let me show you how the band works. Guess I gotta go up there every time, right? All right. Literally, the band has a little balloon on the inside here. Okay, it's a clear balloon, and I'll pass it around so you can see it. Okay, and then this is it's all silicone. Okay, solid silicone, so not liquid silicone. Don't worry, it's not going to leak. And then has a little titanium at the connector here, and a little titanium at the base of this here. All right. And it's okay to have titanium in your body. A lot of people have it in joints, and it's okay to have silicone in your body. A lot of people have silicone in their body. Okay, so you can have it. It'll be fine. It's not reactive. Literally, it comes disconnected like that. We connect this afterwards.
You have reflux and hiatal hernia.
Great. If you have a hiatal hernia, and we find that when we go in and we see that, we fix it, and that takes care of your reflux. A lot of people have reflux and they really don't have a hiatal hernia, or maybe they say they have a hiatal hernia, you go in and you don't find it. It really is a dimple. I mean, it's hard to explain, but it will be like this dimple and an opening where the esophagus goes into the abdomen. It should be nice and snug like this, you know? And a hiatal hernia would be wide like that, and the stomach kind of slides up into the chest. This is the chest. It would slide up like that. Let's say the person's laying down, right? So you have to pull that down and fix it. Maybe snug it with sutures or put a patch on it. And that fixes the hiatal hernia in order to put the band on. So we have to fix that anyway. However, if you don't have a hole there, okay, simply putting the band on there changes the angle of the stomach and reflux goes away. So after the band, you should have no reflux.
So you shouldn't have any.
You should not have reflux. If you get reflux with the band, it's either too tight or you're doing all the wrong things. Okay? Or you have a slip.
What's the maximum amount of years that someone has had the band on?
It's over 20 years. Not this band. Bands themselves have been around over 20 years, different types of bands. And so far they haven't had to be removed or exchanged. We don't know 50 years from now, if you have it for 50 years, if it might have to be exchanged or removed. It is unlikely, but even if it does, it's not a hard operation to do that. It's actually pretty quick. So, but it's supposed to stay in for life. Yes, ma'am.
Where do you perform your surgeries?
Right here in Memorial. We have a team, 2 teams here, and we also have the teams in the floor, so everybody knows their function, and that's why we do that. It takes a long time to train a team.
Yeah, question. What are these, I was looking at the book and it showed like 2 different ways to do the procedure. It looks like you had like small injections, but then you had one that had an actual slit. Like,
That's an open procedure. Nobody really does that.
Okay, so it's usually just
The little tiny incisions. The biggest one is about slightly big. Well, you know, it's the size of the port. Who has the bands out there? Let me get them back. Need one more. Where's the other one? Okay, good. So the biggest incision will be the size of the port. You gotta get that in, right? And the others will be the size of the tip of my finger. So they're very small. What else?
What do you have to do to prepare your body for the surgery?
Well, prepare your mind is more important. Right before surgery, we put you on Optifast for a couple weeks, 2 to 3 weeks, depending how big you are. Mostly here is what we look at. And the reason for that is to, shrink your liver size, because usually the liver is going to be very, very big. And we have to work underneath that liver. So it'd be like the equivalent of working under the hood of a car but without the, the hinge that holds it up, so we'd be constantly having to pull it up, and it'd be overlapping, and it'd be really difficult to see anything. But that way, it would be dangerous for you, we can cause an injury. So by putting you on the Optifast for a few weeks before surgery, it shrinks your liver. And the reason we use Optifast, we can use other things, but there were studies done and it showed that works, and that's what we use. And also Optifast, it kind of sucks the first day or two because you're going to be hungry, but after the second day, you can cook dinner and not even care to eat. Kicks in, and you be pretty comfortable. And each one of those is a meal replacement. So each one of those little Optifasts, it's a whole meal. It's not a supplement. It's very different. If you buy a supplement, you're not getting all the nutrition you need. Each one of these is a full meal. So one of those is it's like having lunch or dinner.
Is there any medications or anything or other medical conditions that would bypass that?
Aspirin or aspirin products, if you are taking a small amount of aspirin because of a stent or something, is there a small chance you can get an ulcer or an erosion? Yes, but that's more important to take that, okay? And chances are nothing will happen. If you're popping in anti-inflammatories like naproxen or Motrin and all those things, you're just begging for an ulcer or an erosion. You can't have those things. Or prednisone. If you're on prednisone chronically, you can't have a band. In fact, you probably can't have anything else either.
So that medication would?
Yeah, the good thing about the Motrin or things like that, if you're on it for your joints and stuff, it's not going to be good for the beginning, but once you lose weight, you're not going to need it. So it's just that you can't really have it with any of the other procedures either.
This Optifast, I'm not familiar with it. Is it?
We sell it at the office, so we'll give it to you as much as you
No,
need.
what I meant is it's just you're on that liquid.
Yeah, that and
fluids?
some broth and stuff like that. I mean, it's yeah, we have to. So otherwise, it becomes very difficult to operate
I
it.
understand.
Yeah, that's not for long.
How long after the surgery are you on the liquid as well?
Oh yeah, after surgery, I'm glad you meant to mention it. Right after surgery, you're going to be on clear liquids, so broth and juice and stuff like that, stuff you can see through, and you're going to be on that for a week. Now, after that, that week you're not going to be hungry at all, because we don't even fill your band when you do it, because just the swelling from the surgery, a little bit, you're going to feel just full, and so you got to drink all day long. But a week out from that, then you start getting a little hungrier, things go in a little bit easier. You're going to be able to take full liquids, that's thicker liquids. The week after that, you do puree. I recommend to my patients just buy baby food, because puree food the baby food is easier. And have that for a week, and then you do soft foods, which would be mashed potatoes and things like that, and then solids, and then you stay on solids.
And that's with all three of the different ones? All three of the surgeries? You stay
The
kind of-
sleeve is what we don't do bypass, but the sleeve is the same thing.
Okay.
Someone who's diabetic who's taking oral medication.
Aha, that's really cool. I like that, because the moment we put you on the Optifast, the sugars start to drop. And some people, and I'm not going to say it's you, okay? It may not at all be you. We have really actually had patients that after they completed Optifast, they're off their medicine. Okay, it's happening. It's happening. I love it. I love it because all my life I wanted to cure people of something, being a doctor, and we weren't able to cure a lot of things. That's why I became a surgeon, because at least I can cure a gallbladder, what I mean, or appendix. But there are a lot of diseases we can cure, but we can actually, put diabetes into remission. And that's wonderful.
But then why, when someone is diagnosed, for instance, as a type 2 diabetic, why isn't this offered as a remedy?
I wouldn't offer surgery right off the bat. I would offer weight loss. Weight loss should be offered. And that's the thing we talked about the AMA calling obesity a disease now. They're going to have to do that now. Okay? Because it's tied into diabetes, it's tied into cancer. So you have to address obesity now. Okay? That's going to be the trend. Everybody's going to have to address it. Because before, people wouldn't address it. Oh, you're diabetic, but yeah, you're like this. You haven't even talked about the person's diet or losing weight. And it works so well. You lose weight, about 90% of the people, roughly that number, 85 to 90% of people, will go into remission. Now, notice I said remission, because if you gain the weight back, the diabetes will come back. But it's great. Remission is a great thing.
And one more question.
Yeah, sure.
Is there an age limit? Are senior citizens eligible for
well,
this process?
Yeah, it depends. I did a 70-year-old lady, but she, looked great, and she was in great shape, and now she's 76, and she's doing fantastic, and lost all her weight and kept it off. If you're 70 years old, then you can't even walk, and you have end-stage liver disease or kidney disease or cardiomyopathy, what's the point? You know? I mean, it all depends. We take it on a case-by-case basis. When over 65 it's a kind of case-by-case basis. But there are a lot of people who've done in that age group because they have a good chance of living another 10 or 20 years. So it's worth doing.
Oh, my granddaughter wants to live 30 more years.
Well, I'm not going to ask you how old you are here, but you look pretty young to me, so I mean, it sounds to me like you can. Yeah. But I mean, I expect that lady at 70 to live at least 10 to 15 years, maybe even 20. She's in great shape. They walk Brandon Mall every morning and just go around. So she and her husband. Yeah.
Sorry to bother you about a piece of paperwork, but we're asked to select a doctor. And
That's your choice.
Okay. Okay.
I can't make that for you.
all right.
But I love it if you selected me, but you can select anybody. Well, in our group, actually, select anybody in our group. We're all good.
Okay.
They're all great doctors.
All right. Thank you.
Yeah. Otherwise, I wouldn't be partnered.
Yeah.
So, what else?
Is there a weight limit that
No.
exceeds?
People like to make you think that there is, but there isn't. We've done really heavy patients with them, right?
So you got success with?
Oh, yeah, absolutely. Yeah.
Okay.
Yeah. It's not here. It's here.
Okay.
Yeah. It's our mindset.
Is there any other testing of any kind other than?
Well, we don't do severe number of tests. If you have cardiac risk, we'll get a cardiologist to see you. If you have really bad lungs, we get that. But it's not like we need to go through a battery of tests. I mean, we do have some tests that we work routinely to make sure you're going to be okay. So the whole point of this is that you do well, right? That's pretty much it. This is not a very big surgery. Even though it is major surgery, it's not an extremely risky surgery. You don't lose a large amount of blood, practically very little. Anything can happen, of course, but knock on wood, it's pretty straightforward. The operation takes about 30 minutes, maybe a little longer if you have to take some time on that. So pretty quick.
So basically, when the patient sees you in advance, you go over their medical history
Oh, absolutely.
and determine
Absolutely.
whether.
You know what? And then you're gonna think I'm crazy, but this has always worked for me. When I see you, I've always, and I've done this for years, is I try to find reasons not to operate. Instead of finding reasons to operate you, I find reasons not to operate you. Why should I not do your surgery? And if everything checks out, that way I don't miss it. Now, that doesn't mean I'm human. I can still miss something. But usually that has worked very well for me, approaching it in that direction. And if everything checks out, okay, well, good, I can do it.
How about for hernias, umbilical or ventral, is that a problem?
It doesn't get in our way usually to do the surgery, and we don't fix them unless, of course, it needs to be fixed for an emergency reason.
Right,
That's a
right.
different story. But they should not be fixed until you lose weight.
I had developed one during pregnancy, and she's like a year old now, but.
Best thing is to lose weight and then get it
And
fixed.
but does it go back normally? I mean, no, it doesn't.
It's a hernia, it's a hernia.
Yeah, okay.
I went to a surgeon and he said until I lost the weight, he wouldn't operate.
Yeah. Well, it's smart.
That's kind of what I'm
He's a
thinking.
smart surgeon. What you want to do is stay away from surgeons. Say, yeah, sure, I'll do it, and then, a year later or less than that, it's back. I mean, what's the point? Just so that you can do it? No. I mean, it's going to come back. So lose the weight and then get it done, and you're done. Same thing with the veins. If you have really bad varicose veins or venous insufficiency, you want to get that laser of the saphenous vein. It works great. A good surgeon is going to tell you until you lose the weight, because no sooner am I going to complete this, you're going to get it again. So once you do that and then they do it, wow, the results were wonderful. Tummy tuck, same thing, until you lose enough weight. A good plastic surgeon will say, come back when your BMI is 30 or less.
When you do a weight loss program, if you're a primary care physician, and they do prescribe pills to help you lose weight, is that okay?
Sure, I mean, whatever you do before that is fine. When you do the weight loss with me, I mean, not that I want you to, I'm just saying, I usually put you on almost like a meal plan. It's not even a diet. It's a meal plan very similar to how you're going to be eating with your band. And the way I look at it, if you've got to do 3 months or 6 months medical weight loss with me, might as well get you to practice. I want you to practice eating for the band. So that when you get your band, hey, I've done this for 6 months. It's pretty easy. You won't be perfect. It's okay. You may not lose a ton of weight. That's okay. You know what? You're going to change your habits. What else? That's it. right, well, thank you so very much. And I think, Dee, are you going to take over and talk? Okay. Pleasure meeting you all. Hope to see you again. Thank you. Thank you very much.
We welcome you to email us now to learn how to schedule your consultation. Simply email us at matt@themediabeast.com. Thank you again, and congratulations for taking that first step.